Hi, welcome to my YouTube channel. Today I want to talk about one of the issues that worry a lot of guys and they are shy to talk about: premature ejaculation. So what is premature ejaculation? A lot of people ask. It doesn't really depend on time. But let's look at what premature ejaculation is. Premature ejaculation is when you ejaculate before a sexual intercourse or 2 minutes after sexual intercourse. So it is a whole lot about your inability to control your ejaculation. So when you have lack of control of ejaculation, that's what we call premature ejaculation. So let's look at the causes of premature ejaculation. We have what we call anxiety, depression, and stress. That is mainly based on psychological. That's a psychological cause. Anxiety, depression, and stress. When you are stressed out, when you're having anxiety and depression, you can have premature ejaculation. We also have erectile dysfunction. I will do a video on erectile dysfunction, a very deep research on erectile dysfunction, and I would like you guys to subscribe to my channel to get this amazing information about erectile dysfunction. But let's focus on premature ejaculation. Also, when you have inflammation of your prostate gland, you can have premature ejaculation. That's when you're having any inflammation of your prostate gland, you can also have premature ejaculation. Also, we have testosterone deficiency, when your testosterone level is very, very low. This hormone is responsible for your libido, and when this hormone goes down, you are going to have premature ejaculation. So you have deficiency testosterone, you can have premature ejaculation. Also, we have weak pelvic floor muscle. So you have a muscle that helps to contract to help keep ejaculation and delay ejaculation. Now these muscles are found in your pelvic region. And when these muscles are weakened, you lose control over ejaculation. Now these muscles are very important, and like how we build our biceps and our triceps, we must build and strengthen our pelvic floor muscle. So if you don't strengthen your pelvic floor muscle, they are going to lose their strength. So I'll talk about how you can strengthen your pelvic floor muscle. A lot of people don't exercise their pelvic floor muscle, and that's what have become one of the causes of premature ejaculation. So when muscles are not exercised, they go through what you call atrophy. That the muscles lose their strength. So these muscles are responsible for your sexual strength and stamina. So if these muscles are loose, are weakened, you are going to have premature ejaculation. So now let's just shift to the treatment of premature ejaculation. The treatment of premature ejaculation depends on the underlying cause. So you have to see your doctor for medical examination to know what is really causing the premature ejaculation. Premature ejaculation can be worrying, and it can cause a lot of psychological issues in relationships. So now let's look at the treatment, the basic treatment. As I already said, premature ejaculation, the treatment depends on the underlying cause. So let's look at the psychogenic cause. That's when the premature ejaculation is caused by a psychological of effect. So we have counseling. You have to see your sex therapist. You have to see your doctor, and you'll be counseled on ways that you can improve your delay of ejaculation. You also have your management of stress. You must manage your stress. Anything that you do that puts your body in stress, you must manage it if you want to solve the issue of premature ejaculation. Also, we have relaxation exercises. So in all relation to how you can manage your stress, you have to relax your body in order to control your ejaculation. We also have the mind control exercise. That is when doing sexual intercourse, you can take your mind out of what you are doing to reduce the excitement. So when you take your mind out, some others think about football, some think about other things, just to take your mind off what you are doing. So the whole issue of premature ejaculation is about too much excitement when you are very, very sensitive. So if you want to reduce the sensitivity, you must control your mind, control the excitement, and that can help you to delay ejaculation. Also, let's look at the organic causes. The organic causes are the causes that are related to your anatomy and physiology of your pelvic region. So now let's look at the organic causes and how we can treat them. The first one is drugs, and the drugs are actually used when you're having premature ejaculation with erectile dysfunction. And these drugs are Viagra and Cialis, and you have to get these drugs from a doctor. You can't just go and buy these drugs. I recommend that you go to a doctor for the doctor to prescribe the drugs for you, Viagra or Cialis. That's when you are having premature ejaculation related to what? Erectile dysfunction. You don't have to prescribe it for yourself. You don't have to just start taking them. In some adverse situation, your doctors will combine Viagra and Cialis, but you can see your doctor who will prescribe the best drug for you. Also, we have what we call the Kegel exercises. Now, these exercises are for what? Strengthening what the pelvic floor muscle. For strengthening your pelvic floor muscle. And a very simple exercise. You can do it in the restaurants. You can do it at any place. You just have to identify your pelvic floor muscle and how you can strengthen them. So guys, this is about going to the gym just at your relaxed state, doing a gym when you are relaxed. And I'll come to show you how you can do what? This Kegel exercise. I'll do a video on the Kegel exercise, but now I want to just show you a simple way that you can strengthen what? Your pelvic floor muscle. So it's like you going to urinate. Then as you are urinating, you try to stop your urine. So as you stop your urine, you will feel a contraction in your pelvic region. That is your pelvic floor muscle. So like you are urinating, then you stop urinating, you contract. That contraction, you have to identify that muscle that have been contracted, and that is what? Your pelvic floor muscle. Now let's look at how we can exercise them. So it's like how you exercise your biceps, you contract, you relax. So this is how you do it. You identify the pelvic floor muscle when you are urinating. You stop urinating, you contract it for 10 seconds, then you release the urine, then you stop again, contract for 10 seconds, you release, you do that thing for maybe 10 reps, you contract for 10 seconds, you release, contract for 10 seconds, you release. After you identify this pelvic floor muscle, now when you are lying down, when you are at the bus station, anywhere you are, whatever you are doing, you can contract this muscle, release it, contract for 10 seconds, release it for 10 reps, 3 times a day. It's okay. And you don't have to exercise them too much. You don't have to exercise them too much. If not, you weaken them. So you have to do it. I recommend 3 times a day. And you do 10 seconds, 10 reps. 10 seconds, 10 reps, 3 times a day. Also, we can use the numbing creams. So just to reduce the sensitivity of the region, you use numbing creams. And one of the creams that you can get from the pharmacy is a lidocaine gel. Lidocaine gel can be used. You apply it around the penis just to reduce the sensitivity. It's an anesthetic cream that you can use to reduce the sensitivity. That's lidocaine. We also have what you call the start-stop technique. The start-stop technique. So you start the sexual intercourse. When you get to the climax, that's when you're about to have an orgasm. Then you stop. You stop for some time. When you are losing the sensitivity, then you do it again. So that's what we call the start and stop technique. And this is going to help you to just send an information to your brain. And after you do this for a very long time, you get what? Endurance. So it's all about endurance in exercise, in building muscle, in building your sensitivity. So you do the start technique. It's going to help you to develop endurance, to delay ejaculation. We also have what we call the stop and squeeze method. So like you have the penis at the point of you ejaculating, where you have reached an orgasm. At the head of the penis, when you are about to ejaculate, you hold it, you hold the point of the penis, and you squeeze it just to send that information back to your brain that you don't want to ejaculate at that time. So by doing that, you send information to your brain, and if you do this for a very long time, you develop endurance over ejaculation. So guys, these are the treatment measures that we can use to treat premature ejaculation. I know this issue is worrying a lot of guys. That's why I've done this video, to just explain the causes and the treatment that we can use. So guys, if you like this video and want to learn more about your sexual health, I'll be doing a video on erectile dysfunction. I'll be doing a video on erectile dysfunction. So you subscribe to my channel for you to get these amazing videos. Thank you.